Today let's talk about transient ischemic attack. It's a part of neurology in general medicine, and this question is asked as a 2 marker in the university examination. So let's see what all we should write when transient ischemic attack is asked. Transient ischemic attack causes sudden loss of function, and it is usually lasts for few minutes with complete recovery, and there is no evidence of infarction on imaging. I'll just repeat once again. What is transient ischemic attack? It causes sudden loss of function. It will last only for few minutes, and there will be complete recovery, and there is no evidence of infarction on imaging. These are the 3 important points that you have to write while asked about transient ischemic attack. Sudden loss of function, few minutes, complete recovery, and no evidence of infarction on imaging. Previously, it was called like the duration of less than 24 hours, but now it is not used, like no longer used this definition. Now we are using only the thing that I have told in the previous slide, like sudden loss of function usually lasts for few minutes, complete recovery, and no evidence of infarction on imaging. Now let's see what are the clinical features that you have to study. While writing the clinical features, you have to divide it into anterior circulation and posterior circulation. Anyway, there is a blockage in circulation, so that's why the attack is happening. So symptoms are accordingly. So anterior circulation, that is mostly carotid system, and posterior circulation, that is vertebro-basilar system. So you have to study around 2 to 3 points from anterior circulation and posterior circulation. While coming to the anterior circulation, you know amaurosis fugax that you have studied in the 3rd year ophthalmology, like sudden loss of vision in the eyes, like transient loss of vision in the eyes, aphasia, hemiparesis, hemisensory loss, hemianopic visual loss. This hemisensory loss and hemianopic visual loss you can write in posterior circulation event. Hemisensory loss and hemianopic visual loss. And posterior circulation, that is vertebro-basilar system, that will be having diplopia, vertigo, vomiting, those features also. So once again I will repeat, anterior circulation and posterior circulation. Anterior circulation is consisting of carotid system, and posterior circulation is consisting of vertebro-basilar system. And anterior circulation, that is carotid system, is having amaurosis fugax, aphasia, hemiparesis, hemisensory loss, and hemianopic visual loss. Coming to the vertebro-basilar system, it includes diplopia, vertigo, vomiting, choking and dysarthria, ataxia, hemisensory loss and hemianopic visual loss we have discussed in the anterior circulation also. Then if you want, you can remember the remaining points like bilateral visual loss, tetraparesis, loss of consciousness, and that is rare, and transient global amnesia. These things you have to remember while writing the part for the clinical features. So now let's see the diagnosis part. The diagnosis is solely based on its description, and it is unusual to witness an attack as they are so brief, because in the OPDs and all we can't witness an attack, because while they are coming to the hospital only the attack will be over. So what the patient is telling, I was not able to see anything, suddenly I felt unconscious. So these features, description only, through that only we can make the diagnosis. And consciousness is often preserved in transient ischemic attacks. So the clinical evidence will be there. While having a transient ischemic attack, we can see these things like any carotid arterial bruit or stenosis, atrial fibrillation or any dysarrhythmia, valvular heart diseases or endocarditis, any recent myocardial infarction. This may be there, or any underlying condition, that is atheroma, hypertension, postural hypotension, bradycardia or low cardiac output, diabetes mellitus. These things can be there, like any underlying condition, because these are the risk factors for developing the transient ischemic attacks. So while the patient is having the diagnosis part, you can just diagnosis only based on the description, because you can't witness an attack. And you have to see whether in recent episodes of these, like atrial fibrillation, myocardial infarction, is there any recent episodes of these things, or any underlying conditions, like these are the risk factors, hypertension, atheroma, any conditions, diabetes mellitus, any conditions like these are present or not, you have to see. So now coming to differential diagnosis, cerebral amyloid angiopathy. It is one of the most important points that you have to keep in mind, because it can cause transient ischemic attack-like events. And the identification on imaging is very necessary in this condition, because here the antiplatelet therapy is contraindicated. The mainstay treatment of transient ischemic attack is antiplatelet therapy. But the cerebral amyloid angiopathy, it is contraindicated. So we have to be very careful while ruling out this condition. So it is one of the most important differential diagnosis. The second one is migraine. We all know migraine will cause visual loss or dysphasia, and while coming to the elderly population without any previous history and all, it is very difficult to differentiate between the migraine and transient ischemic attacks. So we have to keep in mind these two important points. That is, one is cerebral amyloid angiopathy and the other one is migraine. Coming to the prognosis part. The prospective studies that shows a 5-year after a single thromboembolic transient ischemic attacks, it has shown that 30% of the people had a stroke, and third of these is in the first year itself, and 15% have suffered a myocardial infarction. So that is what prognosis shows. And for calculating the prognosis, there is a scoring system like ABCD square scoring. In that, age is there, BP is there, clinical features, duration, and diabetes. Because ABCD is because A for age, B for BP, C for clinical features, D for duration, and D for diabetes. If the age is more than 60 years, score 1 is given. BP is more than 140 mm per Hg systolic, or diastolic is more than 90 mmHg, then 1 score is given. Clinical features, unilateral weakness is there, 2 score is given. Isolated speech disturbance is there, 1 score is given. Any other things, there is no score given for that. Duration of symptoms, it is more than 60 minutes, 2 score is given. 10 to 59, 1. Less than 10, 0. Diabetes is there, 1 additional score is given. So if the score is less than 4, it is having low risk, and the score is greater than 6, it is having high risk for developing stroke within 7 days after transient ischemic attack. So for that, ABCD score is used. Coming to the investigation part. The investigation that you have to know and you have to write is Doppler ultrasound of the internal carotid arteries and cardiac echo, ECG and 24-hour tape, MRI brain or MR or CT angiography. I repeat once again, Doppler ultrasound of the internal carotid arteries that you have to do, cardiac echo you have to do, ECG and 24-hour tape you have to do, MRI brain or MR or CT angiography you have to do. Coming to the treatment part. The mainstay treatment is medical therapy. We have to immediately give the thrombolytic therapy if it is not contraindicated, as I have discussed in the differential diagnosis part. What medical therapy you are giving is mostly it is given aspirin 300 mg per day. And also we have to treat the underlying risk factors also. I have already told atheroma, diabetes, hypertension, so many risk factors will be there. We have to treat those particular conditions even to prevent further transient ischemic attacks and to prevent the patient from developing any myocardial infarction or stroke. The coming to surgery or stenting is if there is symptomatic carotid stenosis or something like that, high grade will be there. We have to do the stenting, and that should take place within 1 week of transient ischemic attacks. That also you have to keep in mind. The main treatment is medical therapy only, but according to the underlying condition, what is causing these attacks and all, you have to see those conditions and you have to treat accordingly. And thank you all. I hope you guys now know what to write for 2 markers while transient ischemic attack is asked. So thank you.